Welcome, Dr. Coleman.
Thank
it's a
you.
pleasure to have you. You have a long list of studies and very important studies on the subject of post-traumatic stress, post-abortion. Can you tell us about them?
Sure. In the last 5 or 6 years or so, we've published a number of studies that have linked abortion history with anxiety, depression, and substance use and abuse is one of the less easily detected effects of abortion. But we have published a few studies or other studies out there on that topic, and it seems to be one of the most common ways that women deal with the trauma, the pain, the suffering, without having to disclose the nature of the source of their problem. In the United States, it's very easy to obtain a prescription for Xanax or a tranquilizer or antidepressive medication, and so I think for a lot of women, they suffer alone, they medicate that way, and so it's an enormous problem that I think we're just touching the surface of. Lately, we've shifted gears away from the mental health effects to looking at how abortion history may impact the family, parents, partners in a relationship, and because the effects do go far beyond the woman who's suffering. So that's, we feel like we've pretty well established that link between abortion and anxiety and depression and substance abuse and PTSD, and so this just seems like the natural place to go with the further study. So,
and in your studies, there's a clear difference between spontaneous abortion and induced abortion in the incidence of trauma.
Yes, well, we had one study published where we did compare. Other groups have done more in terms of those kinds of comparisons, but we did have one study where the outcome measures involved substance abuse, and we did find that no effect for miscarriage or stillbirth, but with the abortion, that it was a dramatic increase in substance use that persisted. So I think that's an important comparison, because the studies that have been conducted in Europe, the researcher is Brown, B-R-O-E-N, she found that initially, women who had a voluntary and involuntary perinatal loss had similar levels of PTSD symptomatology, and then when she followed them to 2 years and 5 years and found that the women who had the non-voluntary losses had pretty much resolved the psychological trauma. Most were doing fine 2 years and 5 years later, but for the women who aborted, it persisted at that level of about 25% at the later assessment. So it does not seem to resolve like a miscarriage and stillbirth.
With such consistent findings, do you have any impact on the medical community, and do you find it's compulsory to tell that to the women?
Yes, I think it's very important that women are informed of the risks, and it's very difficult to get the professional organizations in the United States anyway to acknowledge the research, because we have published in good peer-reviewed journals, and so the information should become part of the body of knowledge, but it's actively ignored. There is a task force that was assembled by the American Psychological Association to study the effects of abortion, and I'm serving as a reviewer for that process. And our studies are cited. So they are, maybe that's progress, that they're at least acknowledging they exist, but the extent to which they dismiss them, we'll have to see. So it is a battle, because the journals are also tied to the professional organizations that have a socio-political agenda that's very clearly pro-choice. So it's much more difficult to publish anything showing negative effects of abortion. And I naively thought that once we had the papers in the journals, that people would have to pay attention to it, and it's just not the case. The professional organizations continue to ignore it for the most part, to say it's bad science, despite the fact, one of our studies was in the American Journal of Obstetrics and Gynecology, where we found women who had an abortion in the subsequent pregnancy reported 10 times the marijuana usage, and alcohol was increased, cigarette smoking, and so there's a dramatic effect in a very difficult journal, and yet they dismiss the study as if they have one methodological flaw, and any study is going to have some limitations. So So it is tough because getting them published is the first obstacle, and then getting the professional organizations to acknowledge it, and then once you get sort of beyond that point, it's the average person, and how do we get the liberal media to pay attention? And so, if a study is published, there was one published by Rousseau in the British Medical Journal, and using the same data that we had used, she just reconfigured the variables, and her bottom line conclusion from that report was that there wasn't any association between abortion and depression, and it was blasted in every newspaper all over the world. And we're lucky if we get one or two newspapers that cover an article when it's published, and it's usually conservative. The Christian media has done a great job of publicizing the work, but still the women who are the average person considering an abortion, or the average doctor or counselor working with women, just doesn't get this information. So.
Do you find that there are women out there that, because it's not recognized, they won't get help?
They may not. Yeah, I think there are probably hundreds and thousands of women out there suffering alone, maybe fearful of telling their spouses or parents or children, be embarrassed. There's shame and embarrassment and guilt, and so they may be, they may not even want to acknowledge it to a trained professional or a family. So. Yeah, I think in all of the speaking that I've done and conversations with clinicians, it does seem like there are many, many women out there who just there isn't anybody to turn to with,
Okay, thank you.
Thank you.